Hi, my name is Dr. Davis, and today we're going to talk about self-care for your muscles. Now, you've likely been diagnosed with one of three things, either a myalgia, a myofascial pain, or a myofascial pain with referral. In all of these, the muscles of your head and neck are affected. More than likely, it's going to be your masseter muscles or your temporalis muscle, although any of the muscles in the head and neck region can have these same issues. If you were to go to a physical therapist for this issue, what would happen is they would do three things. One is ice and heat, the next is massage, and the last is stretches and exercises. We're going to talk about each of these in this video about self-care. The first one I want to talk about is ice and heat. Now, I recommend that you try both of them. Some patients really respond well to ice, and other patients respond really well to heat. Now, there are some cheap and inexpensive ways to do this. Although if you're interested in buying a special ice pack or a special heating pad specifically for your head and neck, that is a good possibility as well. So although you can get something like this for your head and neck, you can also just get something out of your freezer and do it for ice. Now, what I recommend for the ice is that you get a thin towel and put it over the top. That way it's not directly over your face. And then what you want to do is put it directly on this site. So for example, if I'm having pain in my left masseter muscle, I will go ahead and put it directly on there for 15 minutes. After those 15 minutes, I will then go ahead and relax and let it sit for at least 45 minutes without. That is all you need for ice. Now for heat, it's a little bit different. There's a couple of different ways to do it. Although you can buy a special heating pad, the other option is you get a washcloth, get it wet, and put it in the microwave for about 30 to 45 seconds. It'll get really warm, so make sure you touch it with your hand and make sure it's not too hot. After that, apply it directly to the site. So again, if it's my left masseter that I'm having an issue with, I will put it directly on that muscle. That moist heat will draw that heat right into where it needs to be. Again, 15 minutes on, for at least 45 minutes off. Now, some of my patients don't like the moisture on their face, so there is another option. And that's something called a rice bag. Now, you can go and buy a special rice bag, such as this one, and then put it in the microwave for 1 to 2 minutes and heat it up. Although there is a nice, cheap, inexpensive way to do it as well. What you want to do for that is get a nice big athletic sock, fill it full of rice, and then tie off the top. Once you've tied off the top with that rice, you've now created your own little rice bag. Again, you want to put that in the microwave for 1 to 2 minutes, and then you're going to put that directly on the site. Again, 15 minutes on, 45 minutes off. And that is what you want to do for heat and ice. Now, the next step is massage. Now, if you're going to do the heat, I recommend the massage right after because those work really, really well together. The way you want to do the massage is if you want to do for the temporalis muscle, you're going to take 1 or 2 fingers and then you go in small circles on the affected muscle. You want to go over those fibers that are affected. Now this muscle up here, the temporalis, is a big fan-shaped muscle. It goes all the way from right here to the back of the head. So you want to make sure you get any of those muscle fibers that are affected. So 1 or 2 fingers in circular motion all the way back. For your masseter muscle, you can do the same thing. Go in circular motion here. Now, this will be really good at getting the external fibers of the masseter muscle, but it's not going to be very good at getting the deep fibers. The way you're going to get those deep fibers is you take your thumb, put it inside your mouth, your 4 fingers on the outside, and you're going to squeeze the muscle. It looks something like this. You're going to feel that muscle right in front of the bone, and you just want to squeeze. That's going to be able to get those deep muscle fibers really, really well. Now, this is something I don't recommend doing in public. It's something great to do while you're sitting there watching TV, while you're sitting relaxing, reading a book. You can sit there and massage that muscle. For the other muscles of your head and neck, most of those you want to squeeze. For example, if this muscle right here in your neck is affected, you want to go ahead and squeeze it. This is called the sternocleidomastoid muscle, and it's designed to help turn your head. So you want to make sure you squeeze it. For your shoulders, your traps, again, you want to try and squeeze that. This one is a little bit difficult. So if this muscle is affected, you want to have someone else do it for you, unless you have some really good range of motion in your shoulders. So that is massage. The last thing I want to cover in this video is a special stretch. This special stretch is going to be able to stretch out these muscles, which are your closing muscles for your jaw. I call it the two-finger stretch. What you do is you take 2 fingers, you're going to put it right between your teeth, and you're going to sit there for 5 seconds. It looks like this. That's all I'm asking is 5 seconds, 5 times per day. What I usually recommend is that you do it once when you wake up in the morning, right before you go to bed, and one at each meal, so you make sure you get those 5 times. I just ask for at least a minute in between sets. Now, a normal opening is 3 fingers. So if you're able to get 3 fingers in, this stretch is not going to do as much for you. But if you're having tightness and soreness in these muscles, more than likely 2 fingers is going to be a pretty good stretch. So I want you to do that for the time being. At some point, we may talk about doing some other exercises to help you with these muscle issues. But for now, this is what I want you to do. Thank you.